Bismillahir Rahmanir Rahim. Assalamu alaikum. I am your fellow colleague Mohammed Reda Sewilam from Professor Dr. Taha Labib's unit. Today I'm going to tell you how to examine the anterior chamber. The most important thing to know is to see more normal cases than abnormal cases to estimate the anterior chamber depth. Now let's start. This is our torch and this is our patient. First, let's take our torch from the nasal or temporal side, and I'm looking from in front. Now I'm looking from the side, so that my torch should be from in front of the patient. So as I can see the space between the iris and cornea, which is the anterior chamber, I can estimate its depth from here. Now this is a shallow anterior chamber. The most significant sign of shallow anterior chamber is the eclipse sign. It is a shadow lying on the iris. Shadow lying on the iris when I am handling my torch at 60 degrees from either side and I'm looking in front. This is the shadow. As we can see, it comes on the opposite side from the source of light. Here is it. On the other side, my torch, as if it's nasally, the shadow is temporal. There are some. What makes the anterior chamber shallow? Flat cornea, cornea plana, total anterior synechiae, and something in the globe which is hypermetrope. Right. Now let's restore our normal anterior chamber again. Our normal anterior chamber, let's take the iris back to its place. This is somehow displaced iris or going up anteriorly. Now I'm going to replace it back, and now it's so normal right now. As we can see, there's no shadow, hardly no shadow at all at 60 degrees. See, no shadow. And if I'm seeing from the side, it's normal depths, almost normal depths. Manipulating the torch is so important. See, no shadow too. This is a normal anterior chamber. Now let's go to the deep anterior chamber. How to know the deep anterior chamber? There are some diseases that cause deep anterior chamber, like displaced iris to back, like aphakia, pseudophakia, the pseudophagus, or corneal bulging, corneal ectasias. This is the bulging of the cornea, keratoconus, for example, and the globe. If the globe is elongated, myopic eye, yeah, that makes a deep anterior chamber. So right now we know what causes the anterior chamber, and see the depths, and see the depth perception from in front. If I'm looking from in front of the eye, it's wonderful to see it. See too many patients and you can estimate it. See, if I'm looking from the side of the patient right now, wonderful, the space is so deep. The anterior chamber is all illuminated, the space between the iris and cornea, the anterior chamber is so deep. That's it if I'm looking from in front. Now let's take a summary for the anterior chamber examination. At first, shallow anterior chamber, the most important thing is the eclipse sign, which is a shadow on the iris on the opposite side. If I'm taking my torch from the nasal side, it will be on the temporal side at 60 degrees, and vice versa. If I'm looking from the side, I'll see that the iris and cornea are too close to each other, and now like flat cornea, cornea plana, total anterior synechiae, and my hypermetropic eyes. The deep anterior chamber, myopic eyes, corneal ectasias, aphakia or pseudophagus. I think we just summarized our video. Hope you enjoy it. Thank you very much. Mohammed Reda Sewilam, I'm fellow colleague. Thank you again.